Today let's discuss some myths and facts in contraception. What is contraception? It is a method used by women to prevent pregnancy. There are different methods. One is natural method that we calculate the fertile period and we avoid sexual intercourse during that period. Number 2 is condom, which is a barrier method used by male partner to prevent the contact of semen into the female vaginal tract. The other methods include intake of birth contraceptive pills, and there are some other methods are the insertion of intrauterine loop. So there are lots of methods in contraception. So today let's clear some myths in contraception. First, many patients will be asking, ma'am, whether taking birth control pills has any long-term effects on fertility. No, it is not so. Whenever you stop the contraceptive pills, your fertility will return. It will not affect your future pregnancy. Number 2, after delivery, while during breastfeeding, every woman thinks that she will not get pregnant. So they'll be coming and asking whether any contraceptive method should be used or what are the chances of pregnancy immediately after delivery. So the fact is, after delivery, there is one hormone in the blood called prolactin. This hormone inhibits the release of egg from the ovary. This prolactin hormone will be maintained in the blood as long as you are properly breastfeeding. But in some cases, if the prolactin hormone level imbalance occurs, there are chances that egg might release and there are chances for pregnancy even after 1 or 2 months of delivery also. So after delivery, better to use at least barrier contraceptive condom if you have sexual intercourse. Next thing, whether birth control pill causes cancer in future outcome. No, it is not so. The usage of birth control pills will reduce the risk of your endometrial cancer as well as your ovarian cancer. It will not cause cancer as such. Whether usage of condoms makes the intercourse less enjoyable. So the perception of sensation will be different for the partners, but as such it will not reduce the sexual pleasure or libido. It depends on one's own perception. The next common question is, what are the chances of pregnancy while you have intercourse during the periods time? See, in the first and second day of periods, the egg will not start to grow, but after 4-5 days the egg slowly starts to grow. Once it reaches the maximum size, it will release the egg and there are chances of pregnancy mostly towards between 11th and 17th day of periods. But in some cases, for those who have irregular periods, irregular bleeding and irregular spotting, we cannot predict when the egg follicle grows, when the egg releases. So even though it is very rare that you will get pregnant if you have period intercourse during periods, but there are chances if the periods are regular with irregular spotting. And the next question is whether we can have intercourse during menses. The answer is you can have intercourse during periods, but the following concerns you have to keep it in mind. During menses, the endometrium is shedding off with blood. So the vaginal tract is fully accumulated with blood. It is a messy environment. Second thing, some women will be having severe pain. Some women will be having irritable mood and severe pain. It makes intercourse less enjoyable. If the woman is not comfortable and not giving consent, better avoid intercourse. What is the medical concerns in that? During menses, the vaginal environment, the bacteria which grows in the reproductive tract in the vagina, the environment, the medium changes. So during intercourse, if come in contact with the husband's semen, there are high chances of infection. Also, when the menstrual blood is coming out, the uterus mouth is little open. The infection can ascend and grow into the uterus also. So the one alternative thing is that you can use condom while having intercourse during menstrual time.